The condition is an autoimmune illness with environmental factors that can trigger it off, but it is an inherited type of condition. So when you say it's an inherited, it means that it's passed on in families, and if one parent has it, you've got about a 14% chance of developing it. If both parents have it, you've got over 40% chance of developing it. Autoimmune, where your immune system is overworking in certain areas and working incorrectly as well. So if it normally takes about 1 month for a skin cell to turn over, in this condition, in 2 to 3 days, that same skin cell has been turned over. Environmental factors that can exacerbate or trigger the start of the condition: stress, smoking, alcohol, red meat to a certain extent, some types of medication, as we see in our older patients, and certain types of blood pressure, types of tablets, certain types of medication for bipolar mood disorder, etc. They can trigger this condition to come out. And then we see in our younger patients, often the young kids, they develop a specific type where they develop these round plaques, and they're often presented by a viral infection like an upper respiratory tract infection. What we're seeing is with COVID now, it's becoming one of the conditions where COVID can stimulate. So we're seeing people who, COVID is not the cause of them getting psoriasis, but it's the exacerbating factor. So we see people who've got in a family history of psoriasis, and now they get COVID, and suddenly a month later, they develop this condition. In terms of psoriasis, more than any other condition in the world, probably, there's been more alternative treatments that have been actually touted for it. More alternative treatment has been tried. Chinese herbal treatment, Indian Ayurvedic treatments, so many treatments. And the reason for this is because the condition is not a curable condition. Unfortunately, a lot of patients, they go and try alternative treatments. The problem with a lot of these alternative treatments is a lot of them are just products or medication and plants that you put into a pot and you boil, and they turn into cortisone in any case, and that can cause more issues when you come off it. So you've got to be careful with this condition. The first thing is get the diagnosis right, because if you're not someone who sees the condition often, you often mistaken the diagnosis for other conditions, and that's the biggest problem. In terms of helping the condition with alternative treatments, the main thing we say is use good creams and emollients. Creams that are going to hydrate your skin. For example, a lot of people think aqueous cream actually helps. Aqueous cream is used to dry out the skin. Baby oils and body oils, they used to dry out the skin, so it's a good idea to avoid those. You've got to use skincare products which are fragrance-free, skincare products which are hydrating, which are mild, which are not irritating on the skin. Anything that is harsh, anything that causes a burning sensation, generally is not good for the condition, because in psoriasis you get what we call the Kubner phenomenon. If you irritate the area, if you scratch your skin, if you injure the skin, you can get psoriasis in that area. So we've got to use mild products. We know that the sun actually helps the condition. So if you sit in the sun a bit, it does help the condition. You've got to be careful if you get too much of sunlight and you get sunburned. Again, you get the Kubner phenomenon, and the psoriasis can get worse. So a little bit of sunlight helps. Most of the other stuff like tea tree and those things, they don't really do anything for this condition. In South Africa, there's at least 1 million people who have been diagnosed with the condition. We know that the world population, there's about 2% of the population that's affected. South Africa, we think it's between 3 and 5%. And that's because it's an inherited condition, and we definitely see a lot more than in most other places as well in the world. We would say in South Africa it's closer to 2 to 3 million people who have it, and a lot of people who are undiagnosed, who are just walking around with the condition thinking that there's no help and no treatment for it. There are lots of treatment options for this condition. It depends on how severe your psoriasis is. In simple terms, we say you can separate it from mild to moderate and severe. But as a dermatologist, we use a score called a PASI score, PASI, Psoriasis Area Severity Index. And according to that, will make us sort of decide which type of treatment should be used. If it's mild, you can get away with a topical cream. What we've seen is, and you'll see more on social media, the hashtag more than skin deep being used. And that's important because we want our patients to realize psoriasis is not just a skin condition. It's not our medical aid funders, they know that because we've been giving them presentations for years as well, that it affects other organs. patients have a 72% increase in metabolic illness. Metabolic syndrome is where you can get high blood pressure, diabetes, increase in weight. All of these are increased because of the condition. Up to a 44% increase in suicide risk in patients who have this condition. Anxiety and depression are increased. So we want to get treatment early, and yes, there are really good treatment options. When we talk about the newer treatment options, yes, some of them can be costly. A lot of our medical aids are starting to pay more and more and more. If you had to speak to me 2 or 3 or 4 years ago, I would have said to you, it's an uphill battle. We're struggling. The big funders, they don't want to pay for it. But in the last 2 years, we've had a huge increase in the number of patients who have access to this. And the results are amazing. For the first time, we can get clear skin, 100% clear skin with these injections. They can be costly, but a lot of the medical aids are paying for it now. We are still having uphill battles with some of them, some of the big funders. We are ongoing. We've been having meetings for 10 years with them to pay for this medication. This medication is not new. The biologics, which are this new group of medication we say, they've been out for over 20 years. You just said in South Africa, newer ones have been started to come and be available in the last few years. But the results are amazing, and it doesn't only treat the psoriasis, it treats all the complications of it. So patients who took it, their anxiety and depression actually went. They lost weight, the decrease in heart attacks, strokes, diabetes, high blood pressure, all of that because of the medication. So we know that if you control the inflammation from the psoriasis, you can control the condition itself. And on the other hand, having psoriasis itself, it affects your self-esteem. People don't want to go out. If you have severe psoriasis and your skin's flaking everywhere, you tend to not exercise as much. You tend not to go out as much. You tend not to be a social person. So you end up staying indoors. You end up eating more unhealthy. We know that patients with this condition, they tend to consume more alcohol. They tend to smoke more because they're generally away from people. And we know also they tend to do more of that, consume alcohol and smoke more, but also smoking alcohol makes it worse. So it's a vicious type of cycle which keeps on going, which we need to break that. And we want our patients and we want the population to know that there is help out there. You can get treatment. It's not a condition where we're going to say to you, just go home and live with it. And we need to educate our kids, we need to educate our patients, we need to educate our doctors, we need to educate our specialists, so that they can also say to these patients, there is good treatment available. You can get your skin clear.